Welcome to the show today. Today we're going to be talking about Ace Your Moves again with chiropractic care. Today we have Dr. Robert G. Silverman. He is a chiropractic doctor, clinical nutritionist, international speaker, author of Inside Out Health, a revolutionary approach to your body, and Amazon #1 bestseller in 2016. Let's welcome Mr. Dr. Silverman to the show. How you doing?
I'm doing great. How are you today? Happy to be here.
Good, good, good. So, how long have you been in chiropractic care?
I've been in chiropractic care for 21 years, practicing 45 days a week. Got a lot of fun experience, seen a lot of people, helped a lot of people, and still learning how to help more people.
Awesome. So, what made you get into this particular field? Was it something that you thought about when you was younger, or was it just something that you changed your major like I did 8 times before I decided what I wanted to do?
Well, it's a little combination. We call that a gamish. It's a mixture of what you just said. But here's the deal. I was touched by chiropractic. When you go to a manual therapist, a chiropractor, an acupuncturist, a PT, it's because we were helped by somebody in the field and we had our revolutionary moment. We had the epiphany, if you will. So at 21, no one could help me. I went to a chiropractor. I had that epiphany and I said, you know what? I don't like what I'm studying in college. I'm studying to be an accountant. It's not what I wanted to do. I just took anything so I could, be a walk-on Division II basketball player, and everything stopped. I went back to school. I changed my major. I started to take all those courses because I wanted to have people have that same moment as I had. And it's been a totally different flight in life since then.
Oh, awesome. So, tell us more about how the chiropractic doctors, what do they do and what do they specialize in?
Great. Chiropractic is such a vast field. So if you go to 3 chiropractors, you get 3 totally different treatment protocols. But for me, the way I see chiropractic is we are the leading edge on diagnosis on musculoskeletal injuries and what I like to refer to as functional medicine. Now, functional medicine is interesting because it looks at the body from the inside out and tries to get what we call root cause resolution. We look at the body as an interconnected organism. Communication in the body is a critical element. So mechanical, like you had mentioned that your back hurts a little bit, 8 out of 10 Americans have lower back pain, very common. With that being said, you take the mechanical, you match it with the biochemical, and we're able to mold them like a handshake and really get great clinical outcomes. So people think of a chiropractor as just an adjustment. Yeah, that's a tool that we use, but we do blood work. We do soft tissue. We do exercise rehab. We do lifestyle changes. So I saw your eyes light up when I said that because you were like, wait a minute, I just moved your goalpost on what a chiropractor does. So like you play word association, I go into a gym and they go, oh, chiropractor, my back hurts and can you give me adjustment? Which is great. I'm happy there's some association, but it's much more than that. And one of the key things, always remember, when you go to a chiropractor and a doctor, he who treats the side of pain is lost because that side of pain is part of the whole unit. And that unit is called your human body.
Oh wow, that's a lot of misconceptions too. That's why my eyes eventually lit up because you're like, oh, okay, this is what chiropractors do, but they do so much more, and we want to learn that today because we think that there's just a simple-minded thing of just back injuries or so on and so forth. So, what types of pain, other than the normal things that people know, far as you said, the musculoskeletal? So, what did that encompass? What is some of the things that you kind of normally see other than back pain?
Well, you got your lower back pain. Absolutely. You got your neck pain. I happen to treat a lot of concussions, believe it or not. I'm a sports oriented practitioner. So none better than a chiropractor to really assess and treat a concussion. Most people wouldn't realize that. Ankle sprains. Ankle sprains have such a reoccurrence rate. 80% of ankle sprains reoccur because people aren't treated right in their rehab appropriate setting. It's something that we call proprioception. Proprioception, your balance in space between your nervous and your muscular system. Knee injuries, hip injuries. So the best way to describe it, if it has a joint and muscles around it, a chiropractor can help you with it.
That's awesome. So you did mention sports. So what are some of the common injuries that sports individuals come to you for? You did mention ankle, but are there any other common injuries that they kind of, they associate themselves and then they come and see a chiropractor?
Real common, especially in the overhead sports like tennis, football, baseball, a lot of shoulders, a lot of rotator cuff, a lot of labrums. What's really grown in occurrence has been the hip injury in the hip labral area. So everybody says, it's funny. What did you say? I have a back injury. I don't want surgery. I have a shoulder injury. I don't want surgery. Somebody in the medical field has done a great job to think anytime we're hurt, surgery is the answer. And it's more than that, the only answer. That's not true. We got to take that medical edge out and understand their alternatives. Surgery has its place. Medical doctors are smart, but nothing is the answer every time. And if you can fix your body without having surgical intervention, if it's appropriate, it's a great choice, because if God gave it to you, you want to stay within those parameters.
That is so true. So this is a question I want to know because, and you tell me if I'm wrong, I don't know this for a fact. So the popping noise that we hear, I think they said it's something like certain gases is moving from certain parts of your bone. So that's kind of the noise that you hear. Does this pain hurt, or is this actually just relieving certain pressures inside of your like muscular skeleton?
Such a great question. It's actually CO2 gas being released. You ever open up a can of soda? It's the release of
Yes.
gas.
Yep.
How about a vacuum? It's released. So there's gas in the joint, and when you move it to a millimeter, it opens up and it pops. The popping sound does not mean you're breaking anything. The popping sound doesn't mean like sticks are cracking or bones are breaking or anything like that. It's just a sign that you're resetting the joint and you've changed what you would call the pressure inside the joint. Now, does it mean if you get an adjustment, it has to give that crack or pop? Nope, it doesn't mean that. But in most instances, it will usually occur. People are like, oh, you cheated me. I didn't feel the pop. I didn't hear the pop. So I always told everybody, I'm going to always have those peanuts. You remember those peanut things where you're, I'll have those there. We'll pop first. If you pop, you pay. How does that sound? I'll pop them all day long. But the bottom line is it's resetting the body like in the alignment of a car so it runs smoothly and doesn't wear away before it's time.
Oh wow. So another question is, what are some of the other than back pain? Because we know this for sure. What are some of the common things that people come to a chiropractor for? I'm pretty sure there's always this alternative thing, and people are like, okay, the doctor told me all of this, I need this medicine, which I'm not a big component of taking medicine, but if that's your thing, then that's fine. But I like to always try to have more of an alternative thing before I start putting things in my body. So what would you tell someone that comes to you that has back pain, right? And they had all these other, options from the doctor.
So obviously you realize, as we talked about, that number one reason that people go to chiropractic, lower back pain. But some of the other things, to answer your first question, very simply, are headaches, neck pain. That's probably number two. As far as alternatives, I think one of the biggest issues is that I believe that a lot of times patients come in and their condition has not been explained. The doctor did not delineate what it was, where they're going to go, and what the options are. So for me, I take a full assessment. I take a full history. I do a full exam, and then I sit the patient down and simply say, here's what you have. Here's what I think is the best treatment plan. Here's how long it's going to take for you to go from station A to station B. And I like to inflect that, I've seen this before. I've helped people with the condition. This isn't new. I'm not nascent to it. Now, usually when you do that, people are much more comfortable with you. They all complain a lot of times, any kind of practitioner, they feel no connection. They don't feel that the doctor's explaining it. They're like, oh, yeah, I can do it or I can't do it. That's not it. I've had more patient referrals from information that I shared than necessarily sometimes treatment outcomes.
Oh wow. Oh wow, that's awesome. So, oh, this is a good question. So, can someone that is expecting to have child, someone is pregnant, can they come and see a chiropractor?
That's a great question. You can't do anything to a pregnant woman that you didn't do before she was pregnant. So she can come in, but there's a tremendous amount of limitations. So my answer is I believe everybody should seek a chiropractor. Only 15% of the population sees chiropractors. Everybody knows to go to the dentist. So if I say teeth, you say dentist. If I say skin, you say dermatologist, right? If I say foot, you say podiatrist. If I say joint or back pain, you may not say chiropractor. You should, and everybody should look at the surface area of the whole body versus your teeth, which are really important. So I'm a big proponent that everybody should seek chiropractic care and come for a maintenance type and a wellness type assessment every month, every 3 months. Everybody's different. Everybody knows to go get their teeth cleaned every 3 to 6 months.
Why do you think that is? Why do you think that's so that people are hesitant to come and see a chiropractor? You think it's because there's an old myth behind the science of chiropractic itself, or it's just the misinformation, or all the above?
I think all the above. I think there's a myriad of reasons why people have maybe not embraced chiropractic. I think that at times chiropractors haven't done a great job of messaging, and everything's a message, and they should message more and show what the beauty of what we can do and where we've evolved and expanded to in our treatment protocols, our assessment, and our clinical outcomes. And who better than in the modern era right now, like during a COVID health pandemic, to go to a chiropractor who can offer you lifestyle, nutrition, exercise. What else can you do? I mean, you have the option, vaccine or no vaccine, but either way, you've got to keep your, what I call your bulletproof vest potent immune. And what we just talked about are really going to help imbue your immune system with its needed nutrients and dropping the weight that'll help overall health. I think there's been some issues also that people have had. Some of the medical people have had some issues with chiros because we're not in a hospital setting. We usually work on our own, like a PT's in a hospital setting, so they know what they do. But the younger MDs, I go and I give a lot of what they call grand rounds and explain to them what it is. There's been a change. So just like everything evolves, chiropractic is evolving, and chiropractic in the medical model, if you will, is evolving. You have chiropractors in Harvard hospitals, hospitals in Wisconsin, and other hospitals in other states. So I think for your generation, because you're several generations, behind me, thankfully for you, it's different because you're interviewing one now, whereas other people would have thought, oh, no way. But I have to say, a good trained chiropractor is a valuable tool in everybody's health armamentarium.
Cool, that's cool. So my last follow-up question to that is: do you believe in the future that is going to change? That the messaging for chiropractic is going to change? Within your book, you do talk a lot about your work and just your body, your health. Do you think that there's going to be some consistency along the way that is going to change? That we'll probably see more chiropractic in hospitals and clinics and so on and so forth.
I think so. And I think part of it is you're having me. So I'm messaging. Hopefully I'm clear. Hope everybody understands. Maybe I shared some salient points for health. But yes, I think it's changing. And because, now I actually present to all these different chiropractors and I see these young new group and they're vibrant, they're bright, and they want to change the world. So when you have that's going to make the mark that was needed, and they can learn from us where we've seen some of the pitfalls. And I do believe that you'll see that chiropractic, not just because we need to be in a medical model, will be accepted as the doctors that we are, and more people will seek us out because nobody gives a better assessment, treatment, and outcome in alternative medicine than a doctor of chiropractic.
That's awesome. Are you doing any other new books? Are you writing something new?
Why do you ask that? Thank you very much for the softball. I appreciate that. I have a new book coming out in June. It's called The Superhighway to Health, 7 Steps to Optimizing the Gut to Brain Connection. It's been a compendium of all my work over the last 20 years. And we're talking about that superhighway. That highway is the gut to brain and the brain to gut axis. And early readings are, everybody's enjoying it. It should be just re-edited in a little while, and it should hit the stands on June. So anybody who's interested, just follow me on my Facebook, Dr. Robert Silverman. We'll have that picture up, and we'll have some pre-sales for it.
Love it. Love it. Thank you for coming on the show today. I really do appreciate it.
Thanks for having me. Have a great day.
All right. Yeah, likewise. Join us in the next